All right, it's 7 o'clock, so I think we'll get started and want to welcome everyone to our first, which of hope several webinars, Zoom calls, whatever you want to call this, as an opportunity to reach out to the community on a variety of topics as we head into the second year of a pandemic. We wanted to make sure that we had the opportunity to uh, communicate with our residents and business owners in just as many formats as we can. And this is something that now that we passed an ice storm and have a vaccine on the way, I think it's more important than ever that we start to re-engage with the community and try to find ways that we can interact in a effective manner. So tonight we thought we'd start off with a little bit of a community discussion on health in the community. And we have two people who are true heroes of the pandemic. Glenda Matchett, who's the CEO of Dallas Regional Medical Center, and Lisa Fox. And I believe, Lisa, you're the head of nursing?
The director of nursing, yes, sir.
Director of nursing. So, and again, they have worked nonstop since last March, helping people who are affected by COVID, educating us, the city, and just doing a variety of things. So I really appreciate them taking a little bit of time to come tonight to share a little bit with the community. We also have Councilmember Dan Alleman with us tonight, and he will be participating as a panelist as well. So to get started, just like to allow Glenda to introduce herself, tell us a little bit of her background, and then we'll get into some questions. So Glenda, take it away.
All right, thank you. So my name's Glenda Matchett, and I'm the CEO, as he shared with you here at Dallas Regional. I actually started in healthcare as a bedside nurse, and just through the years, continued my education, and many doors opened, and found myself here in Mesquite as a CEO. By trade, I am an RN, so I have a master's degree in healthcare administration, and I'm currently working, very slowly currently working on my doctorate. So pandemic slowed that down a little bit, but definitely that is the track that I'm on. It's, healthcare has been, a passion for me. I saw someone post on Facebook that said, if you could do your dream job, what would it be? I saw someone put interior decorator or something like that. And I was really able to say, I'm doing my dream job. So since I was in second grade, I wanted to be a nurse. And so I kind of was like the Israelites. I circled the mountain a few times before I got on the right track and became a nurse. But it has been the most rewarding and wonderful career that I could have ever asked for or dreamed of. So that's a little bit about my background.
Oh, well, Glenda, thank you, and I'm glad you finally found your way, and we're glad you're in Mesquite. So I think my first question tonight is really more about the hospital and your staff. I know we're again closing in on a full year of a COVID response. So how is your staff doing? And tell us a little bit about what y'all are experiencing.
I would say that, with everything that's gone on with the pandemic, that the times are trying, but our staff still remains, the spirits are pretty high. We've had times when they were low and discouraged, and we've just had to really be kind of crafty in the way that we did some things. And I will tell you, one of the things that really has helped the morale of the staff is the support from the community. When you've been working tirelessly, and in the very beginning, we went into, I call it the lockdown stage of closing the doors of the hospital, screening everyone that came in. We did that before it was ever mandated by the county, by Dallas County. We did that just because we had heard what had went on in Washington. We have some colleagues that are in Washington who shared what they were experiencing. So we did it on Friday the 13th of March. And so I will forever remember that day. And then we received our first COVID patient on March the 30th. And so we've remained in COVID patient care mode since then and continue. The staff, I think, have been tired. When I look at my years of nursing, and I think Lisa would probably agree to this, as a bedside nurse, it was not normal or an everyday thing that you lost a patient. It didn't happen a lot. The patients went home, and there are nurses that are a new generation of nurses that are fairly new at the bedside. And when I say that, I say probably 5 years or less of experience. They have seen and experienced those nurses that are working in the COVID units, and it's not just our hospital, but these nurses have experienced and seen more death than probably I have in all the years of bedside nursing, because it didn't happen a lot. You had those few, but a lot of those were expected. And now working in, the emergency room and things like that, yes, we see those kind of things, but not on your typical med surg nursing. So we've really brought in spiritual care. We've added that position to the staff. We've always had great support from the Mesquite Ministerial Alliance with when we needed pastors and when we needed things. But we really felt like we started hearing from the staff that they didn't have anyone. So we brought that in, and that's been a huge asset. The staff are able to talk to someone about spiritual care, and it's someone that's knowledgeable. Pastor Jamie is very knowledgeable of all faiths, denominations, and cultures, if you will. He's got a master's degree in that, so he understands what each different denomination or walk of life or ethnicity or any of those things, what they need. So that was a big thing that we brought. Lots of food, that always motivates staff, sometimes food more than money, but we've just had the support, when you're working tirelessly and you look out and over in the parking lot, there's a group of churches that are praying over your hospital. And I mean, it was not just a few, it was a parking lot full of people from churches that were just out there praying for us. It's, parades that came by our hospital with signs that, said, thank you for, what you're doing. It was the community members that brought in PPE when PPE was short. It was just all those things that we felt really supported by the community. And I tell you, when you feel that kind of support, you really, it gives you that refreshing, it puts wind back in your sail, and you're able to come back and do that over and over again. So I think just being very aware of what the staff are going through, knowing what knowing them personally. And that's one of the things about Dallas Regional is I can tell you, we know all of our staff. I mean, we know them, we probably know about their family, and being able to really know who's having challenges, who has a sick family member, all those things, and being able to support them and meeting the staff where they are, not expecting them to come where we are. So I think that's been, their challenges. And I think, a lot of the nurses have worked long, and not just nurses, and sometimes we say nurses, but we mean everyone really, that have worked long, tireless hours, and they've seen things they've never seen. They've had to put in new processes they've never had. So it's been challenging, but I think overall the spirits are really high. We had disaster number 2. That's the first time in my career I've ever had 2 disasters running simultaneously. So we've been in what we call a code yellow since March of last year. Well, we activated another code yellow last week. So I said, I've never had 2 codes running, code yellows, which is internal disaster, running at the same time. So I think the staff have done great, and we've been able to really, learn from this and grow from it.
Well, great. And I know the emotional toll is challenging, and trying to keep people motivated. Yes. And keep that morale up. So, kudos to you and your leadership for working through that for your staff. And I know the community really appreciates them for what they've done, and for doing it for so long. So on behalf of the community, please thank your staff for being true heroes for us and taking care of us.
We certainly will.
So kind of looking at COVID, what is the state of COVID at Dallas Regional right now?
So just to give you a little statistics, today we have 35 COVID positive patients in-house. And we have 22, this was as of morning report, we had 22 persons that are under investigation, which basically means that we're waiting on results for them. So I'll go ahead and answer the question as people will say, well, I thought you guys had rapid tests and you knew within 15 minutes. We do, but these 22 patients are patients that have presented with, that are definitely having signs and symptoms of COVID, but yet that fast rapid test tested negative. So then there's another test, we can go one step further and it's called a PCR. And so we wait for the negative on that before we rule out that they are not, and we treat those as if they were COVID positive. So really today I'm taking care of 57, treating 57 patients as if they are COVID positive until we rule out those other 22. And I will tell you, probably tomorrow we'll still have the same numbers. And I know today we have started overhead playing a song. I think it's called the Happy Song, or we play that when we discharge a patient, because I'm going to tell you, it will stop you in your tracks when you know, oh gosh, we've had 35 patients today. I've got this many people waiting on a bed. And then you hear that song and you're like, oh, thank you, God. Another one goes home, right? And so we still have, we're not at our highest numbers. We have been up as high as 60 COVID positive, which it was really a challenge. So since March of 20, we've tested over 20,000 patients. And we have had about a 22% positive rate. So just to give you an idea of how many patients have been positive. Now this 20,000 includes, hospital and then our primary care clinics as well. We've done some testing there as well. So we have seen a lot of positive patients through this. And so we're still testing about the same amount consistently every day. So we really haven't seen a huge relief in the number of COVID. I would say, I think maybe we're seeing a few more quicker discharges in the community, a little quicker. We have been very blessed to be able to participate in some research studies around COVID. And I will tell you, to have research of this magnitude in the city of Mesquite, in a community, what we call medium-sized hospital, is unheard of. It was just a timing thing, and a physician brought it forth. We were able to roll this out. We have had several patients in our study that have done extremely well, that came in on lots of oxygen demands, walk out and go home. So we've had we've done, I believe, 4 COVID studies right now. We actually outperformed Harvard and Mayo Clinic in a couple of the studies. We had more people enrolled in it. So that is one of the great things that we have been able to bring to Mesquite, is research in our hospital. And it won't end with COVID. We will continue to do that for other, we will expand that out into other disciplines. But right now, with the opportunity with COVID, it's a great thing to be able to bring to our community.
So with those studies, have you been able to take some of the findings and put those into place in your treatments, or do you have to wait and?
No, absolutely. A couple of those, the findings in those have already been adopted into what we call the standard of care for COVID patients. So we've been able to we have an intensivist program, which are critical care doctors, and they have been amazing through this and really staying up on the latest and what's working. And we've really had some great success around the COVID patients.
Well, with the vaccine rolling out and more the at-risk people in the community receiving the vaccine, what can you tell us about the effectiveness of the vaccine, some of the side effects that you're seeing? What can people expect as they get the vaccine?
There's several different vaccines that, there's several different brands. I don't think we know yet how effective that's been, because we're just, when we look at how far out we are, we're still giving the second round, and some of our staff are just now getting their second shot just because of the way allotments come in. I don't mind sharing that I took the first shot. I think I was tired, but I'm kind of always tired. So I don't know if I could really contribute it to that, but I felt a little fatigued after the first, but didn't really notice anything. Now I will tell you, after the second, we've had several staff members just, run temperature, not feel well. I didn't feel well for several days, didn't run temperature, but I had a headache, a few body aches. My arm was a lot more sore the second time. I didn't really take anything. And I have found that some of the people now that are taking it, if they go ahead and take Tylenol and go ahead and kind of do it ahead of time, I'm not seeing as many people have the side effects from the second shot as we did the first week we got them. So I was one of the first ones to get my first shot. I wanted to set the example. I think I was first in line with the two intensivist doctors. So I was one of the first ones to get the second as well. And so I think we have definitely learned that if you will use some Tylenol and probably take that closer to the end of the week, you can recuperate on the weekend. So those are the results that we've seen. I will tell you, we have not seen one reaction to a shot. We do monitor the patients after they've been given the shot, or the employees, we monitor them for about 15 minutes. We have had zero reaction that we've had to do anything other than tell them their time's up and go. We have not admitted anyone back to the hospital after their COVID vaccine that has died or had any. I don't even know that we've admitted anyone that's had the COVID vaccine that's now positive COVID, and that would be something that we would want to track. I don't think we've even had that. So you can read all the horror stories, but what I've said since the day of COVID began is we live it every day. We know, we know the number of deaths. We know what has gone on. We've seen that. So, I just can tell you what our personal experience is, and it's nothing that we've ever seen in healthcare before. It's nothing like the flu that we've seen. And a lot of people said, well, we haven't heard much about the flu this year. Well, we've been wearing masks and we've been washing our hands like crazy people, and we haven't been going anywhere. So our flu numbers, I would expect them to be low, because the mask has to do something, and washing your hands more often and everybody has gel in their pockets. So we've seen those kind of things. As far as the vaccine, I think one of the things that I want to share is we probably are not much more informed about any of you on when we're going to get more. Are we going to get more? I can tell you we applied to be a state site. We did very well in our processes. We did very well. We have not wasted a dose. We count the doses that we need that day, and if we need to move people around, we don't waste a dose. We're logging everybody into the database, and we requested to be a state site. But I don't know that the state's going to approve that. They, you've heard they want to have the big hubs, and I don't know. There has been a slowdown on receiving the vaccine because of last week, of course. But we are ready. We set up our processes. We've applied the staff to it to be able to serve the community as a state site, and we're ready to do that. We just hope that the state will let us have another distribution.
I think we're in the same boat. We're doing our best to try to encourage more sites. I think some of the larger sites can be intimidating for people or difficult to get to. And I would think that having a more local, more medical environment would probably be a little bit easier for some people, some of our more at-risk population, to get the vaccine.
And we don't do that. We don't want to be a state site because we really benefit from that at all. We don't charge for the vaccine. We supply the staff to run that clinic. We just want to be able to service our patients, the ones that our doctors in the community take care of. I mean, I have doctors call me all the time. I have a high risk patient, I can't get them a shot anywhere. So, we have no motivation on being a state site for any other reason that it's the best thing to do for our community, and to be able to serve our community. And I will tell you, when I came 5 years ago, I committed to the board and to Mesquite at large that we would do everything in Mesquite. We would support Mesquite. We would support all of the things, all of our charitable donations would be within Mesquite that would benefit our children, because we know what our schools, the poverty level in our schools, and we've done that. And we've really, really been involved and done that. And so this to me was another thing and another way to be able to support the community. Same way when we started delivering babies. Why would a hospital stop delivering babies? Because it's not a profitable service line. But there was nowhere for women to have their babies anywhere around Mesquite. So Prime Healthcare, and we took that on, and did that as a community service line. And so that's really the commitment that we have in being your community hospital, is that we're going to try to bring everything we can here to make the care for the patients of Mesquite and the surrounding community better.
We really appreciate all that y'all do. And I think just to close out, you have a large workforce, and y'all are probably now experts in protecting yourselves. You talked about wearing masks and washing hands. So what's the best advice that you can give to residents on how to protect themselves? Because we're going to be in this for a long time.
I think we continue those 3 W's, right? I think that's the important thing, is we continue those with, wear a mask, wash your hands, watch your distance. And I think don't get a false security that, oh, I've had the vaccine. Let me, I don't need to wear a mask. I don't need to do those things. I think you continue those W's, because it's not only the COVID that those W's help. It's the flu. It's anything else that you can come in contact with, certainly folks with the altered immune system. So I think we continue the W's. We keep applying the knowledge that we've learned. We continue to be good partners within the community, and we beat this. And we come out on top. And just like we did last week, we came out on top because we all band together as a community. So that would be my advice going forward, is continue the 3 W's and continue working together as a community.
Great. Well, Glenda, thank you for your time tonight. And again, thanks for all you do for our community. And I think we'll switch gears and go to somebody else who's made a pretty big impact at the hospital and in the community. Lisa Fox is I run into her throughout the community in a lot of different places. So Lisa, tell us a little bit about yourself and what you do, and then we'll kind of talk about why you're on the call tonight.
All right.
Amazing. Let me just say amazing before she starts. Okay. Amazing.
Thank you. I appreciate that. So I have been a nurse for 21 years. I started my career in Victoria, Texas, where I was born and raised. And I started my profession in med-surg at the bedside. Really enjoyed that, but wanted something a little bit more exciting. So I moved to the ER, and that is just where I found my niche. I love the hustle and bustle. I love, the trauma. And that's where I've been for the last years of my career. And I have recently this year moved to the position of director of nursing. And it's a little different. At first, I thought, geez, this is kind of slow sitting in this office. And I would have to go down to the ER, and Glenda's like, you stay out of that ER. That is not where you're going. But let me tell you, it's picked up. You have all of your nursing here. So I've been blessed with the opportunity to serve in this role. And I've been very blessed to serve the community of Mesquite. I live in Midlothian, but I spend most of my wake hours here in Mesquite. And I do get out there and I volunteer, but oh man, I have got to know so many great people and the first responders, the paramedics, the firemen, the police, and all of you. So I've just really been excited about serving all of y'all. And part of that, when I first began work here, I joined the Mesquite Heart Board. And I became involved with that. And we kind of associated ourselves with the American Heart Association. And then a few years ago, we kind of created our own 501c3 organization. And so that we have been lucky enough to have the Mesquite Go Red Gala for the past 3 years and raise funds for that, to help educate the community about women and heart disease. And unfortunately, we didn't get to have one in 2020, but we have something big planned for 2021. But, I'm just passionate, very passionate about that. I want to get out there and I want to teach the community about women and heart disease.
Well,
so I'm sorry, go ahead.
No, I just said, I know you've been a big proponent of the Heart Association and the heart health in the community with the Go Red program. So I think you kind of shared on why you were so passionate, but what really just made you take this up as one of the things that you wanted to lead the community on?
Well, I think just initially getting very involved with EMS here, we were recognizing our EMS, our first responders, for their life-saving efforts. And, getting when we would have those awards, unfortunately, again, we didn't get to have any in 2021, but we would recognize them. We started recognizing those first responders, and then we started pulling in the patients. And then there was a bystander CPR that we pulled in and got to recognize him because he helped save that life. So I think that's just what drove my passion to, we really need to get out there and help one another and definitely help prevent cardiac arrest, save a life.
So to get onto the more of the medical side of it, tell us a little bit about what are the signs of a heart attack? What are some of the symptoms? What do people really need to know about the symptoms?
Sure. And I do want people to know that heart disease is the #1 cause of death in women. 1 in 3 women die of heart disease, and that's a female death every minute. So, we have our typical signs of a heart attack. That is chest pain, usually, an immediate onset of chest pain. We hear a lot of times people feel like they have an elephant sitting on their chest. You have a lot of chest pressure, jaw pain, neck pain. Those are pretty typical signs and symptoms. For females, they may not have those signs and symptoms, and they're very vague. In my years of experience, I see females present, they have the upper shoulder, upper back pain that they come in with, or the indigestion that they think they're having. And another thing with women that's a little bit unique is that their signs and symptoms are very similar to those of menopause. So why they think they're tired, they're extra fatigued, they're irritable, they can't sleep. So those are, signs of menopause. So women tend to delay seeking treatment. Am I having a heart attack? Is something going wrong? So when you delay that treatment, that's when you see an increased risk of cardiac arrest, prolonged heart disease, heart failure, comorbidities from that. So that is why we want those women to be aware of their signs and symptoms of chest pain or heart attacks.
And you talked a little bit about some of the risk factors, but is age, what are some of the other risk factors that people need to kind of watch out for when they start seeing these symptoms?
Sure. So obviously we hear everybody talk about smoking. I mean, smoking is detrimental to your health, not just for heart attacks, for a number of other things. The sedentary lifestyle, unfortunately, I know I can definitely speak. I put on extra weight during this past year. I mean, you couldn't get out and do anything. And for females, especially stress, we carry a lot of stress, emotional. I see Glenda. Glenda, I know you don't have stress. Don't act like you're stressed out there. Nah. But, emotional, physical, mental, and women tend to be in denial. I don't have time. Nobody has time to be sick. And certainly, if you're a young female mother who's going to take care of the kids, who's going to run the errands, things like that. Also, you have, hereditary. You can't really do anything about hereditary. The cholesterol, the high blood pressure. Those are really things that you can't change. But those are some very common risk factors out there.
Well, what are some of the things that if you're in that in the age and have those risks? So, what are some of the things that you can do to try to reduce those risks?
Right.
I assume stop smoking for one. But...
Stop smoking for one. Absolutely. That is definitely one of them. And with and a lot of times in my experience too, we see people with heart disease have high blood pressure. If you've been prescribed medications for those, for heart arrhythmias, for blood pressure, take them. Just because you feel better, that doesn't mean you stop taking them. You need to take your medications. And a healthy diet, low sodium, low cholesterol, low fat. Those are all things that you can help to reduce risk factors that you can't control. I didn't get a chance, and maybe I may have skipped your question, but I didn't really say exactly what a heart attack is. So I want to go ahead and tell you what the heart attack is. So what causes the chest pain when you're having that heart attack is a lack of oxygen to that specific muscle, that specific tissue in your heart. Oxygen is carried on red blood cells, which is obviously perfused throughout your body. But when you have an occluded artery, and when I speak of an occlusion, that is typically a buildup of plaque. That can cause the occlusion. And then also when you have high blood pressure or just from regular perfusion, it can knock off some of that plaque and cause bleeding, which causes a clot, which typically makes a larger occlusion. So that is actually what the heart attack is. And you have a time frame. We say 90 minutes. That's the golden 90 minutes you have when you start recognizing your signs and symptoms to have that area of the heart reperfused.
So when it comes to so somebody presents to you that they're having a heart attack and all of that, what are some of the things that you recommend besides get to medical help immediately? Well,
the first thing that I always recommend is call 911. We'd much rather you come in by EMS than having to pull you out of the car that your loved one drove you in, and now you're not breathing, unconscious, and have had a cardiac arrest. So if you call 911, first of all, you need to recognize the signs and symptoms. Then call 911. I tell you, I've never worked with a finer group of people here in Mesquite, and I have to brag on Mesquite Fire Department because they are the best. And these guys are highly trained, competent individuals, and they're compassionate. And through studies and looking at processes, there's been big initiatives here in the Metroplex. All the hospitals, EMS, they've all studied processes and how to improve those processes. So the moment you call 911, that dispatch is asking you signs and symptoms. Can you take aspirin? If you're not allergic to it, if you have an aspirin, take an aspirin. That's from the first things. But as soon as EMS gets by your side, they are taking an EKG. They get that EKG and it's automatically faxed to our hospital. We get it. They alert. They recognize it's what we call a STEMI, a heart attack. It comes to the hospital. We have that. It's a STEMI. We alert our team, our cath lab team, and then everybody's just ready when that individual gets here. Our cath lab team, and the guys, Mesquite Fire Department, again, they just have those processes down with us for heart attacks and strokes, and it's a great process. And with that, we have what we call our door to balloon. Obviously, that's the angioplasty when you open up that occlusion. We have several cases that are under 20 minutes. So we have a solid program. And I kind of always say if everybody would have their heart attacks between 8 and 5, man, we would have great times. We'd be under 20 minutes all the time. But You know, you get in the rush hour traffic and things like that. That does tend to delay it a little bit, but so important to call 911.
Well, and you just mentioned the time factor, and it's you know, I think once you realize that you may be having a heart attack, that window from getting from your house to the cath lab, the faster that you can make that, the better.
Absolutely, absolutely.
And so that's why it's you call 911, let the paramedics get there and get you into the hospital as quickly as you can, because time is the key factor in the success rate.
Absolutely. Mhm.
Well, another factor in the success rate is CPR. And so can you tell us a little bit about hands-on CPR?
Yes, and you know, the Mesquite Heart Board, that was one of our big um, contributions we wanted to do throughout the city. We wanted to teach bystander, hands-only CPR. You know, there is probably about 18,000 or more cardiac arrest deaths, and about 80% of those occur in the home. So if your spouse, if your child, if you know, if somebody knew hands-only CPR, to get on that chest and start chest compressions, to start perfusing that blood through your body, that can save a life. And you know, thankfully here in Mesquite, we have several EMS stations, so it doesn't take long for EMS to get where they need to go and be at that place. But you know, even if you're not in your home, if you're out and about, very important. You know, we don't even worry about mouth-to-mouth resuscitation right now. There's enough oxygen left in your body for about 2 to 4 minutes. But you have to perfuse it. You have to do those chest compressions to circulate that. So, and if you're out in the mall, I know our malls have one. All of our schools have one. The AED, very, very important to grab that AED. Open it, turn it on, and you do exactly what it says. So that was one of our big goals that we did with the fundraising that we do, is to get AEDs out to community places that don't have one. Excuse me, such as churches, things like that. And we are a heart safe community here in Mesquite. That's a designation through our regional RAC, which is the North Texas Trauma Regional Advisory Committee. And our community is one last quarter of 17 communities in the Metroplex that can be recognized as a heart safe. And what that means is, you know, there's special requirements for EMS, for fire, for schools. We have all of those in place. So, you know, we're doing a great job here, excuse me, to recognize those people and take care of them.
Well, Lisa, I think this is a good segue into a video that our fire department put together. And, you know, as always, we're flying with technology here. So if somebody could just speak up if you cannot hear the video, but we're going to go ahead and try to get this started.
Okay.
Hello, my name is Eric Richmond. I'm a firefighter paramedic with the Mesquite Fire Department. Today I'm going to be going over the basic steps of performing CPR on a person who you believe is in distress or in need of CPR. Now I'd like to point out that the first and most important thing you need to remember is to call 911 anytime you believe a person is in distress. It's important to immediately call 911 in order to get resources on their way to you as quick as possible. Now also keep in mind, if you believe a person is in need of CPR, if you find them on a couch or a bed or some other surface, you need to move them to a hard, level surface, such as this. So now that we've come upon our person, our victim, or we've moved them to the ground, we have a nice, hard, level surface. The important thing is to, again, call for 911 if you haven't done so already. And if there's someone else with you, have them go call 911. Make sure you point at a person, clearly determine who needs to do it, and tell them, go call 911. As well as if you're in a public place, have someone else go see if they can find an AED. Most public locations, most public buildings, airports, things like that have AEDs. If there's an AED available, when they bring it, the most important thing to do is turn it on. It will walk you through everything you need to do. Just follow the instructions of the machine and you can't go wrong. If you're at home and you don't have an AED, that's okay. We're still going to do CPR. We're going to focus on hands-only CPR. At this point, we need to determine if the person is truly unresponsive. The easiest way to do that is to simply lightly tap them. You don't want to injure them, but you want to tap them hard enough and loud enough that you could wake a normal person. Sir, are you okay? I've had no response. This person appears to be unresponsive. The next thing I'm going to do is check for a pulse. 2 fingers, you can find a pulse on yourself on either side of the neck. Do not check both sides of the neck at the same time. You could occlude the carotid arteries. Simply take your fingers, find where you would on yourself, on the victim, apply slight pressure, and feel for a beating. This should take no more than 10 seconds to determine if there's a pulse or not. When in doubt, assume that there is not. Next, once we've determined if there's no pulse or there is, we need to determine if they're breathing. We're going to do this by look, listen, and feel. Again, like the pulse, this should take no more than 10 seconds to determine. What I mean by look, listen, and feel is we'll do all 3 things at the same time. We're going to look at their chest, looking for a chest rise and fall. We're going to listen if we can hear air coming out of their nose or mouth, and we'll also feel whether we can feel air coming out of the nose or mouth. In this position, I can both look, listen, and feel all in the same time and accomplish this in less than 10 seconds. Once we've determined that a person is unresponsive, not breathing, and has no pulse, we need to begin CPR. The way to begin this is to find the center of the person's chest. You should feel the bony prominence that is the sternum. Take the heel of your hand, place that in the center of the chest. Take your other hand, place it on top. You can interlace your fingers if that's most comfortable. Lock out your elbows, bringing the majority of your upper body weight in line with the victim. This will help support you and provide the most effective compressions. You'll begin compressions down and come all the way up. You do not need to bounce. You do not need to remove your hands. Keep your hands in contact with the victim, but it is important that you come all the way up. When you compress, your compression should be at least 2 inches deep and at a rate of 100 to 120, like so. Once you've called 911, you can place the phone on speaker, or if someone else has called 911 for you, the call taker at 911 will walk you through these steps and can also help you keep a good rhythm. Again, continue doing compressions. Do not stop until help arrives and tells you to, or you can simply no longer go on. And that is the basics of performing CPR. Thank you.
Well, I want to thank Eric Richmond, a firefighter and paramedic with the Mesquite Fire Department, for putting that together for us. And it was very important for me to make sure we had a good quality video that we could at least get some of the word out about how to administer CPR. You never know when you're going to need to know these things. And the more people in our community that know it, the better we can be at addressing people who are having a heart attack. So Lisa, just to close out, is there any message that, with the Heart Association, anything like that you want to just pass on to people at this point?
Yes, definitely. Just hopefully we can start offering some classes. Maybe we can have a virtual class for the bystander CPR, because, it's very important that it's done correctly. I'm sure any attempt is very much appreciated, but, it needs to be deep enough to circulate that blood, and you need to come up off the chest, like Eric said, so that that heart can recoil. And again, it's just call 911 and recognize the signs and symptoms. And most importantly, when you're sick, take care of yourself. I can tell you just real quick that when COVID hit, the first half of the COVID months, we saw a huge decrease in patients to the ER and EMS transports. And that resulted in more deaths, more cardiac arrests, because people were afraid to come to the hospital and afraid to seek care because of their fear of being infected with COVID. So they stayed at home and they didn't get the medical help they needed. So again, the hospitals, all the hospitals, us especially, I'll brag on us, we have, processes in place to protect you. And we just want to make sure that you take care of yourself and know those signs and symptoms.
Well, and I think that's a good point is, y'all are, now almost experts on COVID. So you're not going to get COVID just by simply walking into the emergency room. There are safety measures in place. And so that's a good message to end on is don't be afraid to go to the hospital. If you're sick and you need to go, you need to go. So Lisa, I can't tell you enough just how much we appreciate you in the community, being there and helping out, and just all the different places that you end up, but especially for the Heart Board and really trying to get this message out there because it is important and it does hit a lot of Mesquite families. So thank you.
Yes, thank you.
And with that, we're going to go to question and answers. We have several attendees. We appreciate all of our attendees for being here tonight. So if you'd like to put a question into the chat, we'll read that and answer that. Or if you'd like to be brought into the webinar, we'll do that. So just raise your hand if you want to ask the question in person, or if you just want to put something in the chat. The first question we had is, and Lisa, you can help with this one. Do we need to stop compressions at some point and check a pulse before we continue chest compressions, or do we just continue until medical help arrives?
Well, it's recommended that after 2 minutes of chest compressions, you stop and check a pulse. But out in the community, because we want to make sure it's efficient and appropriate, proper CPR, we recommend just keep doing the chest compressions. Again, after 3 or 4 minutes, if you don't have a response from the patient, yes, you want to check the pulse. But hopefully, EMS is right there with you. If you were in a hospital setting, a medical setting, yes, we would stop after 2 minutes and check that pulse.
Right. About the Go Red campaign, where can people go to find more information about how to get involved in Go Red and be a part of the program?
Well, we are resuming our meetings. They are virtually, and we are always looking for new members to join us. There's lots of work to do out in the community. So please reach out to us. We have a Facebook page. You can contact me here at the hospital, but we would love for everybody to get involved.
And what's that Facebook page?
Mesquite Heart Board.
Mesquite Heart Board. Mm-hmm. Great. And is there a way to make donations? Is there information on how to do that on your Facebook page?
Yes, there is.
Okay, great. Always take the opportunity to plug your organization. So.
Thank you. I appreciate that.
Does anybody else have any questions? Please raise your hand or put it into the chat. No, we've got a few members of the Heart Board and people who are familiar with our messages. So we'll give everybody just a couple more minutes. So let's see. How do we request training for our church or any organization? Does the Heart Board put together training programs?
Yes, we do. And we last year before our gala, we were able to go to a few churches in the community and teach the hands-only CPR. But again, you can reach out on our Facebook page. You can contact me here at the hospital. You can just call the hospital and ask for Lisa Fox. They'll put you in touch with me, and we can make arrangements to make that happen.
And I do know that Mesquite ISD Community Education has programs periodically through American Red Cross and their CPR training. And it's again, once we can get past COVID and you kind of gather, we hope our firefighters and paramedics can get out into the community and do some training as well. Right now, we need to make sure that they stay safe and stay COVID free. So.
And if I may, can I just, one thing that we didn't touch on is I want to make sure that the community knows that those COVID patients are not mixed in all over the hospital.
Sure.
We have designated COVID units for those. And as our numbers surge, we have 5 levels of a surge plan. And so we have designated areas for that. We have dedicated staff for that. So if you come into our emergency room, you are going to be on the opposite end of where those patients even are. And most of those patients don't come out of that unit. If they need radiology, they need things, we go into that unit. So it is very, I don't want to use the word isolated, but it's very distant from everything else. But as we move into higher phases, I will tell you, with having the number of patients we have, we're in phase 2. So we still have 3 other additional phases that we can go into before we reach any type of capacity level for the number of COVID patients that we have. But I did want the community to know that we have designated units for that patient. And so even if you were admitted to the hospital with something non-related to COVID, you won't even be in the area, you won't be on that unit ever.
And I think that's good to know. I think, it's a lot of people, probably their first time going to a hospital and not knowing what the experience is. And again, that hesitation can be costly to somebody's health. So I appreciate you adding that. And I apologize. I'm supposed to recognize the names of the people when they ask a question. So Shirley Weddle, I appreciate you being on. And so Shirley's asked, is there anything that the community can do to support the staff and at the hospital beyond what what's currently going on?
I think that's a great question, and thank you for that. I think sometimes just a note in the mail, just a kind note on our Facebook page. People tend to use social media as a way to complain or a way to criticize. Go to our Facebook page, Dallas Regional Facebook page. Say a thank you to the staff. That means huge. If you're not a Facebook user or anything, drop a note in the mail to us, to my attention. I read it to we read it to the staff. We post it. Any little things like that. It's more about the small things now. Just to know that there's still people outside of the walls, because the first few months we couldn't eat all the food that was brought in. There were more snacks brought in, and there were everything. And as time has dwindled, that's changed. And certainly we understand that, and we don't expect it. But now a note would mean a million to the staff. If you see someone in scrubs, thank them. They may not be the nurse, but they may be the dietary person that serves that tray, that makes that food, that cleans that room, because we couldn't do any of that without all of them. So if you see someone out in the community in scrubs, they do something usually in the hospital. So just thank them. And those are the things that really, really do mean a lot to the staff.
Great. So with the different variants, I'm sorry, and this person does not have a name. So so with the different variants of COVID showing up, are the testing that's being provided at the hospital and at the other places, does it detect the different variations that you're finding?
No, it does not. it will test positive for that strain. It will not test for the different strains or the different COVIDs. There's still a lot of research being done about the different strains and the different ones, but no, the test will pick it up. And basically, the treatment plan is the same. It starts out the same. And so at this point, there's not various avenues of treatment for this COVID or this COVID or this COVID, because what we want to remember about COVID, it most of the time in the severe cases affects the respiratory, whether it's whatever COVID it is. So one of the key things is, if you are COVID positive, because obviously out of the 20,000 people that we tested, we didn't hospitalize all those. A lot of those folks went home. And a lot of those were tested in the community. But what we always want to educate about COVID, it's all about the breathing. You can have a headache and get over that. You can have the backache, you can have those. But if you're short of breath, if you can't walk from your kitchen to your bedroom without being very short of breath, you need to seek healthcare. And I think that is one of the things. It's almost like the heart attack. There's a timeline there. If you let that oxygenation go too long, you are going to go into cardiac arrest. You are going to go into kidney failure. You're going to go into some of those things. So it's all about the breathing. So if you're having respiratory issues, and obviously bronchitis, asthma, all those things can mimic that. But don't stay home too long thinking that you're having allergies and you're short of breath and you're running an extended temperature. Don't just assume that, because that respiratory system is what's going to be attacked first, regardless of what the COVID is, what strain it is. It's going to attack the respiratory. So keep that in mind. It's much like the stroke and the heart attack as we're dealing with COVID. If you're having shortness of breath, seek care, because we are finding patients come in and need very high flows of oxygen, and you just can't get that at home.
We've used the term presumptive positive with employees who present with COVID-like symptoms, but and they have the negative test. So we think we try to treat them the same way, just to protect family members and coworkers.
Absolutely, that's the same way we do here.
So and again, thank you for that question. I would think that was a very good a question. I don't think I've heard that answered before. So the last question, and before we wrap up, is from Shirley Weddle again, and asks, would you be okay with students from schools sending homemade cards to staff and patients?
We love it. We just got a big envelope the other day. Doctor's Day is coming up. We usually get to do, things for our doctors. This year, we're not going to be able to, have the dinners for them. So yes, absolutely. Posters that we can hang up. Hospital Week's coming up in May, just around the corner. I would love to cover the walls of the hospital with poster boards. So if any of my teacher friends would love their class to draw, I would love to be able to come in here and just plaster these walls for Hospital Week. And just really, I think that would be one of the neat things. We did it a few years ago at another hospital I was at, and boy, that meant more to them, because it's really interesting to see how those children perceive. They'll draw a picture of a hospital or a nurse or a doctor, and you can tell that excites me. I just kind of get emotional about it, but it's cool. So man, we would love that. If your students did that, we'd be happy to come pick them up. We'd be happy to do whatever. And I know the heart, we work very obviously with Lisa being on the heart board. If your church needs some type of education, or you want us to zoom into a women's meeting, or a lot of our churches have men's meeting or women's meeting. We have some guys we can zoom into the men, have them zoom into the men's meeting, but we're happy to do that and talk about men's health. Prostate cancer is one of the main things on our men. We're happy to have, our urologists zoom in with you. We can have one of our family practice zoom into your church and talk about the COVID or talk about diabetes. So we're happy to do that. And our doctors love doing that. And obviously, a lot of the churches are online and doing live stream. we can educate your church via live stream if you want us to. So we have a very active leadership group here at the hospital that are very committed to this community. And even the ones that don't live here, we call this home, Mesquite, because we are here so much. But we're happy to zoom into your women's group, your teens group, any of those groups that we can, and give the messages on the signs and symptoms of heart attack, stroke, what's going on in the community, what are we seeing in our children, any of those things. So use us as a resource, because at the end of the day, that's what we as healthcare providers really love doing, is taking care of our patients and teaching. I mean, that is a love that we have. So we're happy to partner with our church community. And you can always reach out to me at the hospital, and we will really make things happen for you if you want it to happen.
And just as a reminder, when is Hospital Week or Doctors Week? In March?
March is
Okay.
March is Doctors Week, and Hospital Week is in May. I'll
Okay.
post it on our Facebook page.
Well,
I opened myself up for that one, didn't I?
well, let's just say that if you want to do something to recognize doctors, nurses, or anyone at the hospital, any week is a good week these days.
Absolutely.
And we'll encourage everyone to reach out. Don't wait for 1 week to come up. So, Glenda, Lisa, I can't thank you enough for your time tonight. We will hopefully we're recording this, so we'll put this out, and it'll carry a life beyond today. So we appreciate the partnership with Dallas Regional. I know it makes a community better when we have a hospital that's accessible, that provides health care for all residents. And so y'all are essential to the community. You're essential to the city of Mesquite, and we thank you for all you do. And let us know how we can help you.
And thank you so much for having us. It is such a pleasure to get to do this. And this is the kind of thing that Lisa and I love. So thank you so much for putting this together and inviting us. We were very honored to be able to be with you guys tonight.
Great. Well, I know Councilmember Alleman would like to close us out. So Dan, I hope you have not frozen up. There you go.
Valuable information given tonight. I actually got my card, because I got my vaccine card here that I show that I got my vaccine in January, and then I got the second one the first part of February. And so I'm excited. I'm glad I got those 2 vaccines already. And I'm going to tell you, I could spend a long time bragging about these 2 ladies we have on right now, and they just do a tremendous job in our community. And on behalf of our mayor and our city council, Cliff, I want to thank you, first of all, for putting all this together. That this is going to be continued, a monthly type of community health meeting, and we're going to do it again next month. I believe the topic's going to be nutrition next month, if I'm not mistaken. But also to thank our CEO of Dallas Regional Medical Center. I'm very proud to be on the board of the hospital. And Glenda, you're doing a fabulous job. And I know we've been through a very tough year, even from the middle part of March. But like you said, last week was like something else as well that came upon us that we weren't expecting, but with the ice and the snow. And Lisa Fox, you're doing a tremendous job as well. And I know she was the director of ER for quite a while there at Dallas Regional, and has built strong relationship with those the first responders, firefighters, police officers, and all that they do, and now the director of nursing. So we're so grateful for y'all. I just want to make this one comment, and because I know our mayor would have been on tonight, he would have been here with us, and I know that would have been the plan. But all of us have been affected in one way or another by coronavirus. And just the valuable information you've given us, make sure to get there early if you can. But we've all lost loved ones, relatives, friends, and even this week it hits close to home once again, because it's our mayor's brother that he lost his battle to COVID. And we thank the Lord he's in heaven now, but he lost his battle Sunday morning. And then we have our city councilman, Kenny Green, his stepdad, also to COVID. passed away yesterday morning. So this hits close to home, but it's a valuable reminder to us. We cannot let our guard down. We need to continue to be vigilant and continue to watch out for each other. So I just wanted to leave that note with all of us. And it was a great presentation tonight. And the paramedic firefighter that did his CPR demonstration did a tremendous job. But if you allow me, I would like to finish with a word of prayer, just to pray for our mayor, to pray for our city councilman, to pray for our city of Mesquite and all of our different areas. And I want to thank you two ladies again, because y'all are so involved in our city of Mesquite in so many ways. The chamber, the schools, I mean, y'all are involved every which way, and even with the Mesquite Heart Board. So why don't we just pause right now? Let's just pray, and then we'll just close out. Father, we come to you right now in the name of Jesus, and we thank you for this meeting tonight. And Lord, we do lift up our mayor, and we do lift up our city councilman, Kenny Green, at the loss of their loved ones, oh God. And Father, we continue to stand in the gap for them, but also for other families that have lost family members. And Lord, we ask for your continued wisdom, your continued guidance. I thank you, Lord, for this meeting tonight to continue to inform our citizens of Mesquite. And Lord, that you would just continue to bless our city in every way, God, helping us as we navigate through this. And for all of our businesses, our schools, our city government, Father, we continue to pray for our firefighters, our police officers to stay well, and for all of our workers at the hospital that work tirelessly 24/7. We thank you for them. Thank you for this time, oh God. And we ask these things in Christ's name. Amen.
Amen.
And for all of those of you that have been watching us tonight, thank you for joining in, and thank you for those great questions. And we look forward to the next one next month. So thank you, City Manager. Appreciate what you do.
Thank you, Mr. Alman, Lisa, Glenda, thank you again. And if you have suggestions on topics that would be interesting to the community, please send those in to my office, City Manager's office, and we'll put something together. But again, thank you everyone for your attendance tonight, and we'll see you around the community. Thank you.
Thank you.
Thank you.